Right, so I am doing my presentation on the yellow fever outbreak. So yellow fever is a viral infection caused by a flavivirus transmitted through infected mosquitoes or arthropods. Specifically, the types of mosquitoes are the Aedes or the Haemaggus species. Here is the Aedes here, and here is the Haemaggus species there. Yellow fever is found in tropical areas like South America and Africa. There's an active outbreak in Ghana, Africa, which I will be focusing on today. And specifically in Ghana, it is in the states of Savannah, Upper West, Bono, and Oti. And here in this picture, you can kind of see here's where the states are highlighted in Ghana. And here is a map of Africa just to kind of show where Ghana is there. So since October 2021, there have been 202 suspected cases. And of those suspected cases, 70 have been confirmed. And of the 70 confirmed, there have been 35 deaths. So just to kind of relate to our situation in America here, if we look at the COVID endemic, if someone comes in and they say, I was exposed to COVID, I'm having these symptoms now, body aches, chills, cough, loss of taste and smell, we can kind of say, okay, it sounds like you have COVID, go home and, just quarantine yourself. There's no need to do any further testing. It's just kind of a waste of resources at this point. So it's kind of the same thing here. They look at, where have they been traveling, if they've been in an area where there is an active outbreak, the kind of symptoms that they're having, if they've been vaccinated, and they can kind of go from there. So of note too, unlike many other mosquito-transmitted viruses, infected humans are not dead-end hosts and may, in fact, infect mosquitoes during periods of viremia and spread the virus. Humans are considered viremic to the mosquito from when the fever starts and up until about 5 days after. So to be viremic, or the term viremia, means that the virus is present in the blood, and then when a mosquito bites the human that is infected, a mosquito can then transmit that to another person then. So the CDC has placed Ghana under a level 2 alert for American travelers. This means that Americans, among other people, should practice enhanced precautions when traveling to this area, and traveling is discouraged unless it is necessary. All right, so as I talked about before, yellow fever is an RNA virus belonging to the flavivirus group. It is transmitted through the Aedes or the Haemaggus species of mosquitoes. The yellow fever virus has 3 distinct transmission cycles, so it can kind of be transmitted in 3 different ways here. The jungle cycle, intermediate, or the urban cycle. So the jungle cycle involves transmission between a non-human, so that would be like a monkey and a mosquito. The intermediate cycle occurs, and that involves humans who live and work in like the jungle or border areas who come in contact with these mosquitoes here. And then the urban cycle involves a viremic human, remember we talked about what that meant earlier, who contracts the virus in either the jungle or in the intermediate cycle, who then returns to an urban area. Then the humans are viremic, the mosquitoes bite them, then they go and bite other people, and just kind of furthering the spread of the infection there. Person to person or primate to human transmission has not yet been reported, so that means that you cannot get the virus unless you are bitten by a mosquito. Just referring back to the COVID example, it is not like it is an upper respiratory type of virus where it is spread through droplets like coughing on people or anything like that. So you do have to be bitten by a mosquito. There's about a 3 to 6 day incubation period from the infection to the onset of symptoms. Humans are considered viremic to mosquitoes from when the fever starts and up until about 5 days after. Common symptoms include, fever, headache, chills, body aches, muscle aches, and yellow fever most commonly affects the liver, but it can also affect the kidneys, central nervous system, upper GI tract. This can lead to jaundice, renal failure, encephalopathy, and hemorrhage, and then death in more severe cases. Then you can just kind of see here's a diagram showing symptoms of different body systems there. So to prevent and to avoid this, obviously first and foremost, we want to avoid these areas with active outbreaks. If you do have to travel to these areas, we recommend, or the CDC recommends, that you use insect repellent, wear long sleeve shirts and pants, use protective clothing and gear, and also get vaccinated before traveling. They also recommend that you use screens on windows and doors, use air conditioning, choose a hotel if you are sleeping in a hotel with air conditioning that is in a clean area, that they have screens on their doors. If you're not staying in a hotel and you're kind of out in the elements here, I recommend sleeping under a mosquito bed or a net if you can't be in a room that has screens or doors. They also recommend that you buy a net at a local outdoor store or online before traveling to the country, so they want you to travel with that. And then regarding vaccines, there has been a safe and effective vaccine for more than 80 years. It is a single dose, and it provides a lifelong protection for most people. The vaccine is a live vaccine, so it is a weakened form of the virus given in a single shot. There's no booster shot, it's just that one dose. And the vaccine is recommended for people aged 9 months or older who are traveling to these areas. This is not a common routine vaccination that you get at a wellness visit when you're a child. It is only specifically if you are traveling to these areas. They're not available at just any local hospital. But unfortunately, there are no known treatment, so it's kind of self-limiting. So just treating your symptoms, Tylenol, Motrin, aspirin, rest fluids, that kind of thing there. And you can see here is a mother protecting her children with a mosquito net there. Just kind of additional information that I found interesting was that in 1951, Max Thiele received a Nobel Peace Prize in physiology or medicine for his discovery of the vaccine. This is the first and only so far Nobel Peace Prize given for the development of a virus vaccine. And then the term yellow fever was given to this virus due to the jaundice that can occur, so the yellowing of the skin and eyes. So yellow fever kind of causes the yellow skin and eyes. And then I also thought it was interesting that mosquitoes need to bite an infected human in order to spread the virus to another human, to spread that disease. I guess in my mind, I just kind of always thought that the mosquitoes were the ones that were infected already and that they were giving it to humans that way. I didn't realize that, like I said, the mosquitoes first need to bite an infected human with the virus. Overall, I really did enjoy doing this presentation, and I learned a lot about yellow fever.